Hi everyone, and welcome to today's video. I'm Mary Felling, physical therapist, and today I'm going to be showing you a really great technique for TMJ pain, for TMJ popping or clicking. So let's get started. So this technique I'm about to show you is good for those of you who get clicking and popping maybe when you're chewing food, talking, when you're yawning, or when you're stressed. This is also good for people who are having problems getting their mouth all the way opened, or for people who are having trouble getting their mouth completely closed after they've been talking, yawning, eating, etc. All right, so all you need is a set of hands. And what you're going to do, so I'm starting right now, make sure you're in a nice comfy place. You can be sitting, standing, and you can be lying down. Doesn't matter, just as long as you can follow along with me. So you're going to take these fingertips here, and you're going to press them in and feel for a bone here, this cheekbone. If you really want to go deep, this is called the zygoma. And once you've got a hold of that, and you can press around, and you can feel that how there isn't some hardness underneath it because that's all tissue and muscle. You're going to take your fingers and just follow the bone all the way back to in front of your ear. So it's about here. You can see it's right about the middle of your ear. There's my other side, right about the middle of my ear. And at this point, come down under that bone so that your fingertips, or the fleshy part of your fingers, is right underneath that bone. You are on the TMJ at this point. So in this position, allow your fingers to sink in. They won't go far because there's just not a lot of tissue here. And once you sink in, you hold that, and then without your fingers sliding over the skin, take the slack out down towards the floor. So I'm sinking in towards the nose, and then I'm holding that pressure. I'm not letting go of that. I'm holding that pressure and then taking the slack out. And you will feel this little nice pull on your skin for sure, but this is really helping the TMJ. And then I want you to just change your focus to your mouth and just let your jaw relax, just kind of like it's unhinged. So there's going to be some space between your teeth, and it looks like this. So don't do this on a first date because that will be your last date. All right, we're going to set the timer. You've got the compression in and holding that while you take the slack out. And we're going to be doing this 5 minutes. You don't want to be talking or doing anything else rather than your jaw in this position. So I'm not forcing my mouth open. I'm not like that. I'm just like gravity is just taking my jaw down, and that's where I'm keeping it. It's staying relaxed there. Look at my elbows. They're down here. I'm not out here trying to do this. My shoulders are relaxed. I'm in a nice tall position. My spine is nice and tall. I'm not doing this. Just as a precaution, if you've had a TMJ dislocation, don't do this one. And it might be painful for some of you. And pain's okay, but if it's sharp pain, don't do this. If you're feeling a stretch and a pull and that kind of discomfort, like, oh, I feel like this is just pulling up into my eyes and the top of my head, that's great. That's your body saying you've got some fascial restrictions, some myofascial tension patterns here in the jaw and in your face that are creating tension up into your forehead, up into your scalp. If you're somebody who deals with headaches, you might be getting headaches from TMJ tension. So doing this, if you have a headache, you might find helps your headache too. If you have a headache and you do this technique and you didn't need it, there's no negative side effects. Just means you've got some passive range of motion that your body didn't require, but there's no harm in it. That's the beauty of this myofascial work. So what we're doing is we're staying in this position for 5 minutes, and we're doing 5 minutes because in the JFB Myofascial Release Techniques, mechanical energy, which we're using elongation and compression, mechanical energy, when it's placed into the human body for 5 uninterrupted minutes or more, it elicits this thing called the piezoelectric effect. And this bioelectric flow moves through the fascia after 5 minutes of this mechanical energy. And when it comes to the areas of tension or restriction, dehydration, that bioelectric flow causes that area to soften, elongate, and rehydrate. And when it does, you get relief and release of the tension of a myofascial restriction from around your muscles, nerves, blood vessels, all these pain-sensitive structures. So that means less pain, and it also means return of flexibility and mobility. And when you get the return of flexibility and mobility, you can open your mouth with more ease, less pain, and less dysfunction, meaning clicking or popping. So what are these myofascial restrictions I'm talking about? Well, when the fascia is injured, and it thinks a lot of different things are injurious, like overuse, repetitive use, poor posture over a long period of time, getting some local trauma, getting hit in the jaw by an object, and just stress, just having an emotional stressful day or a mentally stressful day. All of that causes fascia to bind down, dehydrate, and kind of glue down, and that can put up to 2,000 pounds of force per square inch in that area. Well, the fascia surrounds and supports and infuses everything in our body, including our muscles, nerves, and blood vessels. And all of those items, all those structures are pain sensitive. So if there's a fascial restriction in the area, it creates pain. It creates a loss of mobility. It creates a loss of flexibility, elasticity. So doing these myofascial release techniques restores fascia to its natural state. And the nice thing about these don't force a system. We're not forcing anything. We're just putting in mechanical energy and allowing the body to self-correct. That's the beauty. You can't hurt yourself with these things. All right, so 5 minutes is the minimum time. Stay there 8 minutes. If you feel releases and you feel, oh, I can feel this just softening and it feels good, you can be there 8, 10, 20 minutes. Won't injure you. You'll just get more and more releases. All right, so we're coming up to our 5 minutes here. Stay here 6 or 7 minutes, but for the purpose of this video, I'm going to be stopping at that 5 minutes. And what you would want to do if you are having popping and clicking or problems with chewing, do this technique before and after meals, particularly. And then you want to do this for a minimum of 14 days in a row. When you get finished with it, you can always go back. If you feel like, oh, it's tightening up again, you can go right back in and do it again. You can't do it too much. There's no overdoing it. So, all right, thank you for watching this video, and I invite you to subscribe to my YouTube channel so that as new videos come out, you get them as quickly as possible to keep taking care of your body and moving forward with a healthy, pain-free lifestyle. Thanks again for joining me, and I'll see you in our next video.